They cost tens of thousands of dollars, but the training they offer is priceless. From babies born prematurely to those injured in accidents, future health professionals can prepare for emergencies using the very best equipment available. 2 new pediatric simulators provided by the Children's Miracle Network hospitals are helping Gundersen Health System offer realistic hands-on experience. Now, one simulator represents a full-term baby, the other in use right now, a 1-year-old toddler. News 19's Mackenzie Amundsen gives you an up-close look at the new training tools and explains how they can be used to practice different scenarios. Mackenzie?
Scott, the Integrated Center for Education on the Gundersen Health System campus gives medical students and healthcare providers a safe place to learn. It's a place for them to make mistakes so that they can be ready when the time comes to treat real patients. Members of the Neonatal Intensive Care Unit put their skills to the test this morning, practicing on 2 young patients.
He was covered in blood, and there's about a 12-centimeter laceration found on the right side of his head.
In this training scenario, 1-year-old Hank is a patient at Gundersen Health System. He was struck by a boat propeller while swimming in the river.
These patient simulators add a whole new set of realism to our scenarios, which benefits our healthcare staff in many ways.
Hank is one of 2 new pediatric simulators purchased by Children's Miracle Network hospitals.
Our main goal is taking care of kids. That is our main goal, and Gundersen Health System is a leader in pediatric care.
Down the hall, members of the Neonatal Intensive Care Unit work to save Supertory, a full-term baby experiencing complications after birth.
We can set up those scenarios with the technology. It's all run by electronics, and so they can program that in, and then all of our staff or students can practice that scenario.
The simulators mimic real-life patients that NICU nurses might run into in real life. For example, Supertory here is 8 pounds, just like a full-term baby.
Both simulators probably had close to a price tag of $75,000 to $80,000, but for us, this is, it's priceless. It's priceless when a scenario can happen in a teaching moment that can translate into a real life moment and make a difference.
The simulators provide hands-on opportunities for everything from code training to learning how to intubate.
Very critical pediatric patients are very low volume but high risk. So what we need to do is we need to have our healthcare professionals practice on these simulators so that their skill set is up to par as well as their confidence level. So
training exercises that can save real lives of the Hanks or the Supertories in their time of need. Chapel says this is the first simulator for Gundersen Health System that is a toddler age. The Integrated Center for Education previously had a newborn simulator. However, it is 6 years old now and is worn down. She says it will be still used with rotation with Supertory until it is completely phased out. Scott?
All right, thanks, Mackenzie. Supertory. Children's Miracle Network purchased both simulators through fundraising efforts last year, and you helped with your donations.